Good afternoon and welcome to everybody. Thank you for attending this week's Travel Talk show. We're just about to get started, just going to give a few minutes for everybody to join in, and I am just going to mute my phone, which just rang, of course. So, thank you again. Thank everybody. We have some special guests here too, which I will introduce shortly. So this week is a little different. We aren't heading on to a great, fabulous, different virtual tour and location this week. This week we're going to talk a bit about something that is very much on everybody's mind. Of course, everybody wants to travel, and it's the one obstacle we really have right now. So we're gonna just spend the next hour or so talking about COVID-19, what we know, how it's affecting travel, and what we really think is gonna happen in the next few months. We would like to keep the questions till the end of the show. That way you can have, that way we can address them with everybody. So if you have a question at the bottom of your screen, or maybe on the side of your screen, you'll have a little kind of menu, and then it has one area that says Q&A. So if you have a question, you can type it into the Q&A, and then we will get to that at the end. But if you want to kind of chat and you have any just kind of comments or say hi to everybody, just kind of casual chat, you can do that in the chat. So there's also a chat kind of place. Keep your comments not to really address anything about COVID. So we really want to protect against any misinformation. So unless you have a comment that you're going to source from some particular spot, don't put that into the chat. You can save a question for the end. If we know the answer, we'll tell you the answer. If we don't know the answer, we will tell you we don't know the answer. We're not going to kind of guess or try and make up or give our opinions, because again, we really want to protect against misinformation, because that's, as everybody knows, it's been a huge issue with this. Okay, I'm trying to make my phone stop ringing. Okay, so let's get started. So who we are the Women's Travel Club, and we do small group tours for women only all over the world. Most of our women that come to us as solo travelers, but they quickly make friends. So if you want to join and you want to take advantage of a double occupancy rate, we will match you with a roommate. But you can feel safe and assured that once you join the tour, within a day or so of being on the tour, you're going to feel like you're just traveling with a great group of friends. And we really go to amazing destinations. We put a lot into our tours to try and develop tours that we know you will love and are a little bit different from just your average run-of-the-mill tours. I am Marianne Southall. I'm the marketing director for the Women's Travel Club. We also have with us, and they're going to be kind of with you on the chat right now, Irene Murray from operations, and she is the one that if you call in or you go in on the chat, you're usually going to get Irene. And we also have Debbie Grew, who is from the tour department, and she is the one that kind of develops all these amazing tours and makes sure that, all the logistics on your tour run perfectly and that you have great inclusions that you will love. So they are both on the chat if you want to say hi to them, or if you have like a quick question that's not really related to the show, you can jump on there and ask them. But again, any really questions about anything we say, or just general questions, save them for the end and we will address them the best we can. And we also have some special guests. So the first guest I will introduce is Peta Pottinger, and she is with us from Newland Chase, which is a CIBT company. As a client services manager for Newland Chase, a CIBT company, Peta Pottinger excels in identifying corporate needs for immigration and mobility services and tailoring and delivering industry best solutions to meet those needs. Beginning her career with the company as an accountant and business development manager, Peta focuses on the corporate immigration and mobility needs of large corporate clients. She is a graduate of the University of West Indies with a bachelor in sociolinguistics and philosophy. Thank you, Peta, for joining us. We really appreciate that you've taken time out to give us a little bit of help with sorting through some of the immigration and things that we need to know about going to all these destinations that we very much miss. How are you today?
I'm doing well. Thank you for having me. I look forward to supporting your team and providing the information.
Oh, thanks so much. And then we have Siobhan Thomas, who is here from Cibt Visas. Siobhan has worked as an account manager for Cibt Visas for 6 years and specializes in leisure travel. Siobhan is an expert on the sometimes complex rules governing the issuance of visas needed to cruise, fly, or drive across borders. Siobhan has been working in the travel industry for 25 years, and prior to joining Cibt Visas, she worked for American Express Travel, Sutton Place Hotels, and Meridian Hotels. Siobhan attended the University of Massachusetts in Boston. Hi, Siobhan, how are you?
I'm great. How are you, Marianne? Thanks
I'm
for
very good. Thank you so much for joining and helping us with this. And I'm excited for when you show everybody our new tool a little bit later. So that will be great.
Yep.
And then Susan Lawson, she is the Business Development Manager for Allianz Global Assistance Canada, which is our Canadian travel insurance company. Susan has worked in the travel industry for over 40 years. Most of her career has been on the supplier side. However, she did spend time working on the retail side of the business. She joined Allianz Global Assistance in 2015. Susan works directly with Travel Channel partners and is the dedicated business development manager for the Women's Travel Club. I want to thank all three of you for joining us, but hi, Susan, how are you?
Hi there, Marianne and everyone. I am doing great. Thank you so much for inviting me. This is an opportunity that I've been really looking forward to. So it's great to be on the panel with you and your team. Thank you.
Thank you. Thank you for taking the time to be here. Okay, so let's start at the beginning. The virus itself, COVID-19 is a new disease caused by a novel or new coronavirus that has not previously been seen in humans. Because it's a new virus, scientists are learning more each day. Although most people who have had COVID-19 have had mild symptoms, COVID-19 can cause severe illness and even death. Some groups, including older adults and people who risk certain underlying medical conditions, have an increased risk of severe illness. On February 11, 2020, the World Health Organization announced an official name for the disease that is causing the 2019 novel coronavirus outbreak. First identified in Wuhan, China, the new name of the disease is Coronavirus Disease 2019, abbreviated as COVID-19. In COVID-19, the CO stands for corona, the VI for virus, and the D for disease, which is something I didn't realize until they spelled that out, but it makes a lot of sense. There are many types of human coronaviruses, including some that commonly cause upper respiratory tract infections. Okay, so how it spreads, how easily a virus spreads from person to person can vary. The virus that causes COVID-19 appears to spread more efficiently than influenza, but not as efficiently as measles, which is among the most contagious viruses known to affect people. People who are physically near within 6 feet of a person with COVID-19 have direct contact with that person are at greater risk. When people with COVID-19 cough, sneeze, sing, talk, or breathe, they produce respiratory droplets. These droplets can range in size from larger droplets, some of which are visible, to smaller, very tiny droplets. Small droplets can also form particles when they dry very quickly in the airstream. Infections occur mainly through exposure to respiratory droplets when a person is in close contact with someone who has COVID-19. These respiratory droplets cause infection when they are inhaled or deposited on mucous membranes, such as those that line the inside of the nose and mouth. As the respiratory droplets travel further away from a person with COVID-19, the concentration of these droplets decreases. Larger droplets fall out of the air due to gravity. Smaller droplets with particles spread out apart in the air with passing time and an amount of infectious virus in the air also decreases. So how can you protect yourself and others? And we've heard this over and over again, so I'm sure none of this is going to be news to anybody, but stay at least 6 feet from others whenever possible. This is very important in preventing the spread of COVID-19. Cover your mouth and nose with a mask when around others. This helps reduce the risk or spread both by close contact and by airborne transmission. Wash your hands often with soap and water. If soap and water are not available, use hand sanitizer that contain at least 60% alcohol. Avoid crowded indoor spaces and ensure indoor spaces are properly ventilated by bringing in outdoor air as much as possible. In general, being outdoors and in spaces with good ventilation reduces the risk of exposure to infectious respiratory droplets. Stay home and isolate from others when sick. Routinely clean and disinfect frequently touched surfaces and take other steps to stop the spread at home. So this is a worldwide map that shows the concentration of COVID-19 outbreaks worldwide. So some countries have obviously been hit harder than others. It shows the cases per 100,000 population, and this has been reported in the last 7 days from January 25th to January 31st. So just a little past 7 days, but a 7-day period nonetheless. And it kind of shows you where in the world is having the most issue with COVID and where is doing a little less concentration, a little less issues. A lot of it has to do with population density, of course, but it's a good map to give an idea of that. This is also a line graph that's going to show us the worldwide cases per day. So starting from the beginning, so this is way back, this is April 2020, so this is way back starting in like January, February, just when it was starting into April, and then coming up to now. And you can see that we've definitely been through our second wave. We're on the downslope of our second wave, and it's a good sign, as we're hearing in the news and it's getting announced all the time, that our world is healing. We are getting better now, and there's a little bit of light at the end of this tunnel. Okay, and we've also been hearing a lot about the vaccines that are coming out. The vaccines are rolling out throughout the world. Currently, there are 4 different COVID vaccines being used throughout the world, but many others are in development and have started testing, which is very good to keep in mind, because when we hear like in Canada, when they talk about our vaccine rollout and their projections, they only take into account the vaccines that are available for use right now. But we have lots that are in testing and in even the 3rd stage of testing at this point. And as those roll out, those are going to make it even quicker that people are going to get vaccinated. They just don't take them into account until they know for sure that they've passed all their testing and they're good to go. So the projections we hear right now are based on the ones that are currently available and being used. Avoid misinformation. If you have a question, because we get asked questions a lot about vaccines, and we aren't medical professionals, we can't answer them. If you have a question about the vaccines, especially about your personal situation when it comes to your medical health and vaccines, talk to your doctor or talk to a pharmacist. Get the answers from people that really know, not from, you know, your friends, your neighbors, your relatives, or us, because we don't know. Get it from somebody that really understands and has the information and can give you the right answer. This is a great map. This is actually from Bloomberg, and I do look at it quite often. And this map is showing us how many people are vaccinated in certain areas. So you can look at the countries that are doing quite well. Some countries that are grayed out, like Australia, it's only because we don't have information. They aren't supplying information, so they don't know the information. It doesn't mean that there's not vaccines going on there. It just means that they don't have information for those countries. You can see here the darker green is the higher the concentration of population that's vaccinated. So United States is definitely looking really good. We've all heard Israel and the UK and countries like that are doing excellent. But United States, we have a lot of American members, so you should, you know, be happy in knowing that you're up there in the top of the world that's being vaccinated at this point. So as of yesterday, the numbers for the US is 13.3% of its population have had their first dose, and 5.9% are fully vaccinated, which I think is great news that they're that far along already. We've only just started this, and you know, it's just going to increase from there as we get more vaccines that are approved and more vaccines out there. Those numbers are just going to keep going up. Canada, we're a little slower. We had a little bit of an issue with supply at the beginning, but it seems as of yesterday's press conference that that has been dealt with, and we are on a better track now. So at Canada, we're at 1.9% have had their first dose, and 1.1% are fully vaccinated. So Siobhan, I have a question for you. Can you address it all? Will countries accept a vaccine certificate instead of a COVID test?
That has not happened yet. We have a tool that I'm going to be demonstrating in a few minutes that gives you an up-to-date list of what all the requirements are for a specific destination. We're still seeing most countries looking for, negative COVID-19 tests in order to enter. But, we fully expect that as the vaccines become more prominent, that will be changed. But so far,
Nobody. Yeah, we're getting that question too a fair bit, and people are like, oh, what if I don't have my vaccine? Can I get in? We at this point don't know who or if or when countries are going to require a vaccine for entry. So it's a complete unknown as if that will even be a requirement at some point.
Yeah.
Okay, so now the big question we get all the time. When do we think tours will start running again? What we're hopeful for is early fall. So as these vaccines continue to roll out and the numbers come down, and the projections we're hearing from the government as to, what they think is going to happen and when vaccines are going to be done, we're looking for early fall. And again, travel restrictions will just continue to relax as travel opens up, but we continue to monitor everything, and Siobhan's going to introduce us to a new tool shortly that's going to show how we can do that. So let's look forward to see what our plans are and what we hope for travel as it starts to open. The Women's Travel Club continues to work to offer the safest and best options for our members as the impact of COVID-19 continues to unfold. We continue to assess developments daily and modify our policies as needed. The welfare and safety of our members has always been of the utmost importance as we continue to offer great future travel options. The Women's Travel Club and our partners have implemented certain policies to protect you and your investment. So here's a few things that we're doing. Many of our tours now are offered on a zero deposit. This allows you to book and hold a spot on your future tour without the worry of loss of investment. The applicable tours show tentative dates for the future deposits. However, as we can, we'll continue to push them back as needed. Some tours aren't on the zero deposit, and that is just because as travel continues to look like it's going to be very busy for the end of 2021 and into 2022. And space is being just eaten up by so much travel's already been moved, so much travel is moving that's already been booked. And plus people that just haven't traveled are excited to be out and traveling again. So in some instances, we do need the deposits because we need them to hold space on certain activities or certain accommodations. And if that's the case, then we do need a deposit for that tour. But when we can work with our suppliers and continue to hold space without that, then we will continue to offer the zero deposit. So we are not planning to run any tours that still have a do not travel advisory in place for the Canada and the US. We're also monitoring the entry requirements for the destinations we're traveling to. This may result in a tour that you were booked on being canceled or rescheduled, but the safety and travel experience of our members is what's most important. We have implemented a new travel requirement guide on each tour on our website. The guide gives us real-time entry requirements and rules for traveling to and from this destination. Keep in mind that these are the regulations for traveling today and it may change as we get closer to the travel dates for the tour. So you can see this is from actually our website from one of our tours, and on the left-hand menu, as you go down, there's a travel requirements guide. If you click on that, it's going to open up this guide that Siobhan's going to show us now, and that will allow you to know exactly what you need to know about that company. So I'm going to stop sharing my screen and Siobhan's going to share hers and walk us through the guide. And we're going to hope this works okay.
Can you, okay. So can you enable me to share my screen, Marianne?
Sure. Let's see.
Oh.
Is that good?
Yep, now I have it. Thank
There we
you.
go.
Sorry for that momentary break in the action. Thank you, everybody, for taking time to visit with us today. As my name is Siobhan Thomas. I am based in the U.S. I'm in Florida, and Cibt Visas is actually a global company. Peta is based in Toronto, Canada. So I understand that you have a pretty good mix of people from both Canada and the U.S. on the call today. So in any event, to sort of give you some background on Cibt Visas, we're a global visa services company. So what we have is a real niche market, and we assist people who need to obtain visas to travel. And we work with people who are going, who need tourist visas and people who need business visas, and then even people who are going to, live in another country or work in another country. So we have kind of a real niche market. A lot of people say when they ask me, what I do for a living, they're like, oh, I didn't realize, makes sense. Didn't know anybody needed, provided that service. But anyway, so we are the largest visa and passport and immigration services company in the world. And we support Women's Travel Club kind of behind the scenes on obtaining the visas and passports needed to travel. So as you can imagine, when COVID-19 hit, the world of visas was hit pretty significantly hard with, because borders were shutting down. And so what we found was that we were being inundated with questions about, not only do I need a visa to go someplace, but, if I go there, what's going to happen? Do I need a COVID-19 test? Will they accept the vaccine? All the questions that you had. So because we're a global company, we were being inundated with those questions all over the world. So we started gathering that information. And we made an update to our website here, which is, this one is cibtvisas.ca/women's travel club. So it's linked into, the tours that you've booked with Women's Travel Club. So we added this COVID-19 tab to our website. And we started off originally with a travel and immigration blog. So where we were gathering information and sort of putting it in there to update people on what all the requirements were. That quickly became a guide that became like 300 pages. So we changed that over to this latest entry requirements by database by destination database, so that you can go in there and you can search by and enter in what your nationality is. And for you, it will default to Canada based on your IP address, or US. For me, it doesn't do that because I'm on a CIBT test site. And then you'd say, for example, I'm going to Kenya. You want to see if you can go to Kenya. So you live in Canada, you hold a passport from Canada, you're going to Kenya. So it tells you, first of all, a visa is required to go to Kenya, and provides you a link over to get that visa within the Women's Travel Club program. So you would get, we have, because of the volume of business done with Women's Travel Club, they have negotiated, special rates with us. So, would always encourage you to use this site because you would get those special rates. But it goes over what the entry restrictions are. So it says, travelers have to meet the health and travel documents requirements to enter this destination. So this will tell you, first of all, whether you can go there. So this is saying, yes, Kenya is letting people travel there. So then it tells you the entry and health requirements. So in this case, you need to present a medical certificate on arrival. You need to have a negative COVID-19 test in order to get there. They do have a self-quarantine for 14 days. It does not apply to all nationals who are listed here. So it has a list of all the nationals that are excluded from needing to quarantine. And so that does include Canada and the US, last time I checked. Canada and the United States, yep. So this information, sorry to go back here. And then you also have to complete a travel surveillance form. And there's a link over to the form that you need to complete here. It tells you what the in-country experience is like. It tells you what the re-entry experience, and in this case, I said Canada, so it's telling me that in order to re-enter Canada, I have to present a negative COVID-19 test result no more than 72 hours prior to departure. Travelers will be tested for COVID-19 on arrival. So it just goes, without reading all of it to you, it goes into a lot of detail about what kind of travel documentation you're going to need in order to travel these days. So it tells you transit restrictions. So it's also very important when you're booking your travel to understand if there are any restrictions through, transiting another country. So if you were going to, transit through the US on your way to Australia, would you be able to do that? So you'd have to look up the requirements for getting into the United States here in order to understand that. So I want to show you another example of a country like, let's say Egypt. I wanted to find somebody with restrictions. So let's say China. So here it's saying entry is suspended for all foreign nationals except holders of diplomatic service or courtesy visas. So, kind of that, I think a lot of the information that you're looking for up front, which is, whether or not you can go to a specific country, would be right here under entry restrictions. And then once you determine that, you still need to look at entry and health requirements to see what documentation you're going to need. And we are seeing most countries are requiring a, sort of as a general statement, most countries want to see a negative COVID-19 test 72 hours prior to departure. So you need to make sure you time that appropriately so that, you take into mind your flight time too, because some of these are very long flights. So you have to get it within 48 hours of takeoff of departure, because it has to be 72 hours when you arrive. We have not seen, as somebody asked earlier, we have not seen the addition of vaccine certificates yet, but I would anticipate that those are coming. We have been, as India is a country, that of course you need a visa to get to, and we have very close relationships with the government there. And while they have not released their plans yet, I do know that they're, they're considering that you can present a vaccine certificate or a negative test in order to travel there. So my sort of guess on it would be that most countries will go that way eventually, so that you can do either a negative COVID test 72 hours prior to departure, or have a vaccine certificate.
Thank you.
So
We love this
sorry.
tool. This is
Yeah.
great.
Yeah. So-
And another thing to note is this is updated daily.
Mhm,
So it's real-time information as of right now.
mhm.
But as things change, they'll change on here. So we can really keep up to date with the changes everywhere that we're going.
It's actually, you'll see, I'm glad you brought that up. It says here the entry guide is valid as of February 24th, 2021. So the information on this site is actually curated information. So it goes to our specialists. We have a group in the US and in the UK. Goes to those specialists who validate the information, because as you were saying, there are a lot of rumors flying around out there. So when we get, when we're told that a change has occurred, we need to validate that it came from a reputable source. And then we make the update. So it's not really a real-time update. There can be, some slight delay between when the change occurs and when it gets updated here. And the other thing that you might want to look at is this multiple destinations in one glance is really a handy tool for travelers, who are trying to figure out where they want to go. So say, for example, I was sort of dying to get to Europe. So I would put in the names of the countries here. So I think I'm considering France, Spain, and Italy. So I could put all those countries in and do a side-by-side comparison to see which countries, what the requirements are right now, which countries I can go to and what the requirements are. So we are getting a lot of, really positive feedback from travelers about having access to that information. And it will include links over to any health declaration forms. It tells you there, that you're not allowed if you've been to Brazil. It's a lot of information to have to sift through. So, you can also rely on, Women's Travel Club to, be doing that research on your behalf for the tours that they put together. So if you, go to the COVID-19 tab, and it's a country where you can, like Egypt, so you can travel to Egypt. And you needed to get a visa. So I wanted to talk a little bit about what that experience would be like. So you would click here on Get My Visa. And then you'd enter your province of residence, purpose of trip is tourist. Ask you how long, do you need a one entry or a multiple entry visa? In general, a one entry visa, if you are only going, in and out of Egypt once, you should apply for a single entry visa. Many consulates are going to be, they're going to be reviewing your flight itinerary and comparing it to what you've asked for. And, if you've asked for a multiple entry when you only have one trip planned, it can raise a red flag. So then it pulls you over to what the requirements are for getting a visa. It tells you, what the health requirements are up top, and then tells you, what forms need to be completed in order to apply for a visa. So typically you need to provide your passport, a photograph, and then fill out the visa application form, proof of travel arrangements. So it goes into all the detail here. Once you're ready to order a visa, you would click to Get My Visa and be sent a kit that will run through what the requirements are. And I'll pull up a sample of the kit for you. In 1 second. It's taking a minute for my Adobe to work, but this is a sample of what the visa application kit would look like. So it runs into, of course, we upfront talk again about the entry restrictions. We want to make sure everybody's aware of it. Goes through what all of the requirements are, and tells you what forms to fill out, and provide you with a it would provide you with instructions for either, a secure link to upload the information to us, if that's possible, or if the information needs to be mailed in, then you would get a address where it needs to be mailed in, along with a shipping slip of where to mail it to. So we've always provided, visa support. In the US, we are able to process passports. Right now, the expedited processing time for passports is 4 to 6 weeks. There are, there's sort of a very elusive ability to get an emergency passport issued in the US. If your passport is expired, if it's a medical or life and death emergency, then you can call a phone number in order to attempt to get your passport renewed. There are some cases where if you have travel within the next 2 weeks, you can get an appointment in order to get your passport renewed, but these are extraordinarily difficult to get. So I would recommend, take a look at your passport and make sure that it's up to date.
Yeah, this is a good time to just, when you think about it, pull out your passport and just look at the date. Because you think you know, and then you go to, it happens all the time, you go to travel, it's like, what?
Yeah.
So just look at that date.
Yeah. In the US, we're able to help people with passports. In Canada, you have to go directly to the Canadian government passport office in order to renew your passport. They don't allow third parties to assist with that. Yep.
But it's fairly easy to do in Canada, and we can get it fairly quickly if needed. So
Oh, that's good. You're lucky.
I know of emergency situations where people have gotten a passport that day because they showed up at the airport with an expired passport. So
You Canadians are so nice.
I know, we are.
Yeah. But so the other, in terms of COVID-19, we also offer a service called Informed Traveler. So that's if you want to send us the itinerary, we'll do the research for you and send you out an email with the health requirements and entry requirements for that. We also offer a guided entry solution, and that's more of a concierge service for travelers who don't want to fill out the forms on their own. They want to have, one person assigned to work with them. We would assist with completing the forms, and we would help with, sort of walking you through the process step by step. So that is a service that's available. And that's it from me, Marianne.
Well,
I hope I kept my time.
I think everybody will agree, and I saw some chats coming through that it's a great tool. This is, this is what we need right now is information. And this tool is just so handy to give us information current to what exactly, we need to know.
Great. I'm glad it's useful.
Thank you. Okay, I will go back to sharing my screen and see how this goes. Oh, yay, it just left off where I was. I was not really positive it would do that for me. Okay, so we also offer a full selection of travel insurance to protect yourself and your investment. We offer insurance for both our Canadian and US travelers, including cancel for any reason, cancel anytime coverage, and COVID out of country medical coverage. We have Susan Lawson here from Allianz Global Assistance Canada, and she's going to run through some general information that you might need to know about travel insurance. I know we have a lot of our US members on the call today. Just keep in mind that we're going to try and keep this just as general to insurance as possible, but some of the Canadian rules might be different in the US. We can definitely, Irene does all of our insurance and she's on the chat, and definitely for your specific insurance needs, we can help you, walk you through it. So I have some questions for you, Susan. What are some of the biggest challenges that travel insurance industry has faced during the past year?
Well, first of all, I just would like to say thank you again. I've already learned so much in just listening in, and fantastic tool that you have created. And it's wonderful that, Marianne, that you are doing this for your clients, because my goodness, there's so much valuable information. And it's so true that one of the big things that we're all faced with is that there's just been so much information coming at the industry on a daily basis, and just managing, keeping up. And it appears you've done a great job of providing this service to your clients. So thank you for that. It's a pleasure to be your dedicated business development manager, and I so support your approach in how you work with your clients in providing them a holistic approach to booking these trips. And travel insurance is such a key piece. We, especially in this last year, I think that we've all learned more about travel insurance, and so I just wanted to really congratulate you on the job that you're doing, because this is so helpful. Managing all of this information is difficult, and your goal is to make sure that your clients are well informed, and so we're trying to do the same thing at our end. Allianz Global Assistance is a worldwide company, and we're partnered with a company that's, I think we're 23 in terms of largest companies in the world, just in general. And so really, what does that mean to you and to everybody that's online today? It means that even though we have this local touch, if you will, we have a relationship as your business development manager. We have an office in Canada of about 800 people, and also a very large office in the US, but worldwide we're connected. And so when you're traveling in the world, you know that you're connected to our business units everywhere and the thousands of employees that we have. And so that is a comfort for sure. And the other thing, of course, is the fact that this brand, because we are a worldwide brand, this is our core business, is travel insurance. And so we pride ourselves in providing a product that really is completely fully integrated. We do everything. So just wanted to pass that on.
Thank you so much. Oh, so how has Allianz responded to these challenges, would you say?
So for us from day one, when we think back to March of last year, and I personally was traveling, I actually was in Jamaica, and I arrived home on March 12th. But right from the beginning, and I was working from there even though I was on vacation, we recognized that the first thing we needed to do was to help get people safely home. And so in the beginning, that's really what our focus was. That was what your focus was. We worked closely with you as our partners to make sure that anybody that was at destination, that they got the information that they needed, and we helped them to get home safely. So that was a really important piece for us. And then throughout this year, of course, because of all of the changes that have been happening in the industry, we have tried to adjust and make changes to our process and to our product and what we offer in order to keep up with everything that was going on, and keep you informed and keep your clients with trying to give as much flexibility, at the same time recognizing that there are certain exclusions and restrictions to a travel insurance policy. So just really helping people, guide them through it. I think what we learned, and we've all learned in this industry, is that a lot of people purchase a travel insurance policy, and they may, in the moment of the excitement of booking the trip, they're very excited, but they might miss those details that you point out to them, and then they don't take the time to read the policy. We're really encouraging people to do that now, and to walk through that policy so that you really do understand what you're covered for, because that certainly has been a challenge, and we've tried to help everybody, as you can imagine, when they've called us, whether they're at destination or for the thousands of people that in the end had to actually cancel their trips.
Yes. What kind of things are you hearing from travel advisors and others in the industry? What's on their minds?
It's interesting because we are getting sort of a little bit of everything. There's certainly people out that are ready to travel right now, and then there are people that are wanting to wait. And so we're getting sort of that feedback, and we're here to help regardless. And one of the things that we did in just hearing the feedback right from the very beginning was the questions around, well, what about coverage for COVID-19? What does that mean? And so that was one of the things that we did to address the situation. Was we launched our COVID-19 emergency hospital and medical plan. And again, I know you prefaced this in the beginning that I'm really referencing Canadian product at this point, but we launched that COVID-19 plan in Canada, and it was an emergency hospital medical piece and also an interruption as well. What we found is that when we did launch that, for those people that still were comfortable in traveling, that wanted to travel or needed to travel against the advisory, there was comfort in knowing that they did have some coverage. And that has certainly made a big difference.
And that is a great example of a company in, like, typically insurance, people are like, yeah, it's not going to be there when I need it. This is a company that knew like this was an issue and implemented something to safeguard its clients. And that's like huge in the insurance world, I think, to actually do that for clients just to protect them further.
Well, thank you. And, we certainly have had a lot of great feedback on that. The one thing, and I'm not going to go too deep on product, but the one thing to remember with that COVID-19 insurance, that only applies to COVID. So you still require emergency hospital and medical for all the other reasons. And so, that's really important, but it's a standalone. So it can be either sold on its own or it can be sold in conjunction with our other plans. The other thing we recognized, because of the volume of claims that we received in a very short time, that we went to work and we tried to improve our own internal systems, and we launched an online claims portal to help you and your clients to manage through that claims process. And we've had a great feedback on that as well. We also, in terms of when you're at destination and you do have an emergency, you always call us first so that we're there to help. And one of the things that we implemented this year, in addition to the services that we offer, when we triage the case as it comes in, we recognize that there's quite a few people that when they call, they can actually be taken care of through our virtual care. So we have now launched our virtual care. And what that means is if you call in and you have signs and symptoms, but it's not an emergency that you need to get right to the hospital, we'll actually connect you with a doctor and they'll be able to take care of you right there on the spot. So that has really also helped. Again, we're trying to be there for our clients whenever they need help, and that they know that we're all in this together, working with you and with them.
Excellent. So as we've been talking about, new regulations are being put in place around the world. What's the role of travel insurance in this area?
I appreciate hearing all of the feedback on all of the restrictions and all of the regulations and, what are we doing? Well, we have to follow the regulations and we have to try to also communicate them out. We actually have a service now that you can call in and you can give your trip itinerary, and then we will help you. Although I do believe the service that we just heard from CIBT is much more superior to that, but it is a service that's available to you and your clients.
Oh, that's awesome. And what can you tell us about Canadian consumers' travel trends during the pandemic?
Well, it's interesting because we, as I said earlier, we have seen that there are definitely people that are ready to travel or have the need to travel, but we are seeing that more people are definitely wanting to understand their travel insurance, and they're asking way more questions and they want to be educated. The other thing that we have found is that those aid those clients that, even though you presented travel insurance to them, because I know you do on with every sale, they chose to decline it. And this year, what we're finding is any of those clients that did choose to decline travel insurance, they ended up maybe with a future travel credit, for example, from their suppliers. And so now they want to, use that future travel credit and book their new trip. In the past, we never allowed you to insure a future travel credit because there was no monetary value. However, again, given the situation and knowing that there were so many people that did accept the future travel credit, which is wonderful because we want people to travel, they didn't have insurance. So we changed our policy for our partners. And we said, you can insure that credit now. You can actually book that new trip and you can insure the value of the credit, the original amount of your trip. And that has been very, very successful in terms of, addressing the trends in the industry with our clients. That one, it was a big one for sure.
Oh, that's huge. Definitely. And then it just, protects people, because really travel insurance, if you're not somebody that usually buys travel insurance, please consider it, because it, you don't think you need it until you need it. And then you really do need it.
Absolutely. That is so true. I am so grateful for all the people that we were able to help either get them home safely and cover those costs, or the people that had to cancel their trips. And I'm just so grateful that we were there for them and we were able to help them out. So thank you.
Thank you. And this is a question I want to ask you, but I also am going to ask Siobhan and Peta, just for, can be just your own personal opinion, kind of. How are you feeling about the future of the travel industry?
Sure, I'll take that one. So looking at the trends amid COVID-19, it's safe to say that travel will not be restored to the pre-pandemic status for quite some time. We see frequent policy changes on border and entry requirements, whether that be health confirmations and/or additional travel documents. CIBT is staying abreast of these changes, where entry guides and blogs are updated daily to ensure that our clients have accurate and the most up-to-date information. We have also implemented additional tools and services to manage these changes. As such, our clients can feel at ease when they're planning for their next trip. So we have a saying, pre-pandemic, it was know before you go. Now it's know before you plan, right?
Good. Yeah.
Right?
Yeah. And
Yeah.
does anybody else have feelings about where they see the future of the travel industry?
What we have seen
I'll ju-
too on the leisure side is that, especially for 2022, people are planning some fantastic trips. Like a lot of the around the world cruises and things like that are already sold out.
Yes.
So it seems like a lot of people are sort of really eager to, get traveling as soon as they can.
I agree from what we're seeing, for sure. And Susan?
And I'll just add to that. I agree with everything that's been said here. People that are very, very excited about traveling again, in my opinion. And it's, depending on your personal situation and your personal, I guess, risk level, it will decide when you actually travel. But I know people are definitely thinking about it. And I talk to travel advisors all day long, and I am feeling that energy as it's starting to build, and that excitement as people are slowly gathering their information, making sure that they have what they need so that they can make the right decision for their trips. But it's starting to happen.
Oh.
But I think the number one thing that is really going to shine through more than ever is the value of the travel advisor. It has become so clear, and I have watched how hard each and every one of you have worked to support your clients, and it has, well, you've been my rock. You've been my rock as I have watched you just work tirelessly night and day to take care of your clients. And really, really, I think that anybody that does not book their travel through a travel advisor, or more specifically through the Women's Travel Club, it just doesn't make sense to me. And I believe that more people are seeing the value of what you bring. And to be honest, I'm sitting here listening to this 1 hour session and what you bring to your clients, it's fantastic. So your value is definitely, you're worth it in every way.
Yes, so definitely, if you're watching this and you're not thinking about going on one of our tours, but you're thinking, oh, I'd like to take my family to an all-inclusive, book it through a travel agent, because it's not going to cost you anymore. And then you have that person that's got your back. You have somebody that with boots on the ground, that when things go bad, they're going to get you out of that mess. And so, and you might never need that, but it didn't cost you anything to have it. So do it. Just book through a travel agent for sure. Thank you so much, Susan, for all your thoughts. We really appreciate that.
Thank you.
So as we look forward, the Women's Travel Club have launched our 2022 tours early, which gives our members tours to look forward to and plan, while allowing us to secure the space in accommodations and the best options possible. The end of 2021 and 22 look very bright for travel, but space is already filling up. So many travel plans have been moved already. The best advice I can give is, if you hope to travel, you really need to start looking at booking something now, because it's just filling up because of everything that's been pushed back and the number of people that want to travel. We're going to start to announce our 2023 tours in the next few weeks. So if you're still a little hesitant, but you want something to look forward to, we'll be getting some of those tours up for pre-booking. And that's a great way to kind of just dream and plan. And we have increased our Canadian and US trip options. We'll continue to do that. So if you're not ready to travel internationally, you have something more domestic that you can have a look at. So I really want to thank Siobhan, Peta, and Susan for joining us. Your knowledge and information has been so wonderful. And really, I think it's going to help our members feel a little bit better, a little bit more confident, knowing that there's a light at the end of this tunnel, and we're getting through this, we're getting through it together, and we're going to have those great trips together, and we're going to, be having that glass of wine in a lounge somewhere in the world together, chatting about, do you remember what it was like last year when we couldn't leave our living room?
Yeah.
Great. So I just want to open up for questions. Again, please remember, phrase your questions as questions. Don't make broad statements. And if we can't answer them, if we don't know the answer, we're going to tell you that. Hopefully we can direct you to where you can find the answer, but we're definitely not going to give you opinions or kind of make up anything. So let's
Marianne. Hi, Marianne. We've got a number of questions that Debbie and I have not responded to that we can share with you. And then we've got 2 in chat. So can I just present the chat questions to you first?
Sure. Yeah,
Okay.
Why don't you do that?
Okay. So Leslie was asking, with reference to CIBT, what the cost is for that additional assistance?
Okay, CIBT can, I guess, Siobhan?
Yep, for the guided entry assistance, the cost is $399. Yep.
Okay, so can you just explain what's encompassed in that again?
So it's a kind of a white glove service is what I would call it. So you would have somebody to work with you hand in hand as you go through the visa application process. So they would help you with completing the actual application form. So you would fill out a very simple form. We would complete the visa application form for you and send it to you so that you could, check it over for correctness and sign it and send it out. We would help you with any letters, any documentation that needs to be done. So it's really just somebody who, wants that level of service. So they don't want to sort of fill out the forms on their own. They want the form filled out for them. They want us to, basically answer lots of questions. In some cases, some countries right now, countries like China, you actually can, if a business, they're issuing some business visas, but it's extraordinarily difficult. So in that case, we have everybody go over to the guided entry service because, it would be a total waste of time for you to just apply if you weren't an essential worker or anything like that.
Thank you.
Question, the $3.99, was that Canadian or US dollars?
It's the same either way. Yeah.
Oh, okay.
So thank you very much for that. So there's
Yeah.
also a question from Jessica, and I think I have actually responded appropriately, but she's traveling from the US to our East Coast of Canada in July, and she has been reading about accepting a COVID test in lieu of the 14 days. But is it fair to say that it's still evolving and that information will become a lot clearer as we get closer to July?
Yeah, I mean, I would definitely keep checking back on that because I think things are going to change. But,
Yeah.
yeah.
And our entry guide has the information. So I would recommend using the entry guide, looking at the information. Again, it's updated daily, so it'll be there for you.
Thank you.
Yeah.
And actually, one other comment, you did talk about passports, but is it not also important that it be in really good condition?
Yes.
Okay. Yeah.
If your dog chewed up part of your
Yes.
passport, you need
It's
to
not
do
valid.
that.
Correct.
Or
Yeah.
if you spilt wine on your passport, which I've seen before.
Yeah.
Yeah. Yeah. And to your point, we've had stories whereby people are transiting through an airport and say they're traveling with someone else and they accidentally wrote on the back of their passport, then that becomes invalid as well. So
Wow.
be very careful.
Thank you for that.
Cherish-
And also, yeah, thank you. So
Yeah, we had a traveler once who their visa was expired, so they ripped the page out, which you can't do.
Yeah.
Can't do. I get it, I guess.
Don't need this
Trying to
anymore.
travel light, but
oh, Marianne, do you have access to the?
Yeah, so I'll go through the questions now.
Great. Thank you.
Okay, so the first question's going to be for Susan. It's from Carol, and Carol has, I think a little bit of background in this. So Carol lives in Alberta. She has the Allianz policy with the cancel for any reason coverage. And so it says, my current cancel for any reason policy excludes any cancellation related to COVID. Does this mean if my trip is canceled, I do not get my deposit back?
So Carol, just to confirm that you purchased this policy prior to, when did you purchase the policy?
Hold on, let's see if we can get Carol. Hold on, let me. Where's participants? You know what, Carol, if you're here, I'm going to open up your microphone and then you can actually talk to Susan.
Sure.
That might be a little easier. Carol. Okay, I've opened up your microphone, Carol, so you should be able to talk now.
Hi, Susan.
Hi.
So my friend and I are a bit confused because when we bought our cancel for any reason policy, it excludes anything having to do with COVID. So that was in May 2020.
Okay. So
Now, go ahead.
Okay, thanks. So you purchased that policy in May 2020, and at that time, the advisory was already up. So what that means is that you would have an exclusion to cancel because of the advisory. However, the fact that you bought cancel for any reason, what that gives you is the ability to cancel for any reason. And that means when you submit your claim form, you would actually put right on the claim form, cancel for any reason, and you would put personal reasons. So you wouldn't even put COVID anywhere on the claim form because you're canceling for any reason. And with that, as long as you cancel your trip 7 days prior to departure, then you would be entitled under the cancel for any reason to 75% back of your investment. So I'm not sure why you thought that it wasn't covered or it excluded it. The only place where it would exclude it is if you completed the claim form and you were putting in a claim for cancel for any reason, but you put COVID everywhere, then that could maybe, draw a red flag, but you are absolutely entitled to cancel for any reason and get 75% of your money back.
Okay, so the reason we have that idea is because I have a whole separate one-page sheet saying that Allianz determined coronavirus to be a known event for trip cancellation and trip interruption. As a result, no claims related to coronavirus will be payable if your policy was purchased on or after March 11th, 2020.
And that's correct. So under the trip cancellation and interruption policy, you're not covered. But because you added cancel for any reason, which is almost like a rider, you added that under the cancel for any reason, you can put in a claim.
Okay.
Does that help?
Yes, it does. Thank you.
Okay.
So you just
Yeah,
say,
so-
Carol, I just don't want to go.
Yes.
No
You
reason.
just because
We do want to go. We just don't want to lose all our money in the
Yeah.
process.
Well, I hear ya.
But if I can just give you just one other tip with cancel for any reason, Carol, is you want to make sure that you make that decision 7 days prior. You want to cancel your trip 7 days prior, because with cancel for any reason, as soon as you step into 6 days prior up to 48 hours, so that window, then you still get 75% of your money back, but it's now capped at $1,500. So I don't know what the cost of your trip was, but if it was $10,000, if you canceled 7 days prior, you would have got $7,500 back. If you waited until 6 days prior, up until 48 hours, you would have been capped at $1,500. And then if you wait till 2 days prior to departure, there's zero refund. So that's the way the cancel for any reason is. The benefits are tiered. So it's a totally different risk product than our regular trip cancellation and interruption.
Okay.
Does that help?
Yes, that helps. And
Excellent.
so one of the other issues is, and I know Irene has said this a few times as well, that's the way it is in Ontario. So I'm assuming that everything you're saying applies to all of Canada, not just Ontario.
That's correct. And so and again, when I'm talking only Canada. I'm not referencing the US. The US has a different plan. They have a
Okay,
cancel for any time.
We just have to do that because we're in Ontario, and the way Canadian insurance licensing works is you have to be licensed for various provinces. And being in Ontario, there's some provinces we just can't get licensed in. And if we're not licensed in it, we're bound to not discuss insurance for that province. But Susan's a BDM for all of Canada, so she can talk to all of Canada, whereas Irene, licensed in Canada or in Ontario, can only speak to Ontario. Even though we might know, secretly we know, we can't. We're not allowed to.
Okay, and one more quick question about insurance. When you say if the trip is not canceled, but it's moved, say 6 months in the future, do we then lose the premium we initially paid for and have to buy another premium to cover that?
That's a really good question. I'm glad you brought that up because I didn't mention this, but that was the other thing that we adjusted with our process. Normally, what you've just described would have happened, but given COVID and so many people canceled and were given these future travel credits and move their trip forward, we allowed them to move their policy forward. So you bought that policy in May 2020. If you want to move that trip, if your trip gets moved, we will allow you to move that policy with that trip. So we'll keep it together. So you get the benefit of that.
Perfect. Thank you so much.
You're welcome.
Thanks, Carol. You had some really good questions, and I think a lot of people would be very happy that you asked those and they got the answers
Yeah.
for you. Thank you. I'm going to turn off your mic now, but
Thank you.
I will, after I go through the questions that are written out, if anybody wants to raise their hand, we will open your mic and you can actually come on and ask questions too.
Can I just jump in a second, Marianne, because it might be a question that you don't see, but there's one of the women has asked about filling in the travel visa sections. How soon before they're departing on their trip is it best to do that?
So it depends on the country that you're traveling to. So, which I guess isn't really the answer you wanted, but because some countries will issue like a 30-day visa, so you almost can't do it until you're, 2 or 3 weeks out. In general, you should have it done a month before your travel occurs. But again, that will, to some extent depend on the country you're traveling to.
And we
Thank
will
you.
help with any of our tours. We'll kind of tell you, you
Yeah.
need visa now.
Yeah,
kind of thing.
that's part of, that's the
Walk
stuff
you
that
through.
goes on. Yeah, it's the stuff that goes on before the tour takes place, which is
Yeah.
that, we have a conversation with the tour leader and say like, okay, for this country, it's a 30-day visa. They can't, apply until 3 weeks in advance so that they have plenty of time.
Great.
And
Thank
you can
so
also
much.
call us and we'll go through it with you.
Thank you,
Okay,
Marianne. Sure.
no problem. Okay, so Jessica, I know this got kind of asked before, but I'll just address it quickly. She's the one that's coming to Canada, and she reads that there's right now requires a COVID test and a quarantine. Yes, right now it is very hard to get into Canada. It requires the COVID test and the 14-day quarantine, but also a 3-day very expensive quarantine at a government supported hotel. So plus the testing when you get here. However, these rules are in place right now. Things are going to change between now and July. So you're just going to keep kind of watching to see how things do change and what happens. Because right now our country basically doesn't want anybody coming in or traveling. So they've got fairly strict rules. Okay, Linda's question. If you're traveling with this is for Susan. So Susan, Linda wants to know if you're traveling with a travel companion, do you both need the cancellation and interruption insurance, or will one cover each other if cancellation is needed or disrupted?
You both need it because the policy is per person, and so the benefits are per person. So yeah, absolutely both need a policy. Good question.
Oh, okay. And Carol, when you say you can insure future travel credit, do you mean you can pay for another premium, or the premium you paid for initially will provide extended coverage? So if you've insured a trip and the trip can't go and you get future travel credit, will the premium you already have paid continue on with the future travel credit?
Yes, that's what we've allowed. We've allowed you to move that credit forward with that policy and get all the benefits of when you purchase that policy. The one thing I will mention though, because I know there's a number of suppliers that extended an incentive for you to accept a credit. So in that case, you're only moving forward the value that you actually paid out of your pocket, not that incremental incentive that you were given. You can't make money on insurance. So you can't insure that when that was an incentive. Of course, you can upgrade, your room or your cabin or wherever it is and get the value, but you can't cover that. Now, let's say that you had a future travel credit and you moved it forward, but you decided that you wanted to now, upgrade to a suite, and there was going to be an additional cost out of your pocket. We could then insure that additional value, and there would be an additional premium for that.
Thank you. I hope that helps, Carol. And Linda is wanting to know, as part of a book tour, is our company going to be requiring COVID tests, mask wearing, or the vaccine? So Linda, at this point, what we're doing is watching the requirements of both the countries we're traveling from and to, and we will be following those requirements. So and this is a guess, but I am guessing that especially mask wearing is going to be required on flights for quite some time. So that will be, masks will definitely be on the flights. And vaccines and COVID tests depending on the country we're going to. So we'll be following the rules of the travel requirements for where we're going and coming from. Oh, okay. I don't know if any of us can answer this, Stephanie. It's a kind of a medical question. Is it possible to test positive for COVID-19 because you've had the vaccine? And I don't believe any of us are qualified to answer that. No.
No, I'm not.
Yeah, no, that's, you know what, that's going to be a question for your doctor or pharmacist, because we're just not enough. Our expertise doesn't lie in that area. As we've already booked for Rwanda, Uganda trip in September, required to follow the these guidelines for visas, etc. Yes, so again, we're not getting the visas for Rwanda and Uganda yet, but when we are required to get visas, we will let you know. And you can definitely go on and use the tool to book your visas as per needed. And we'll probably talk to you about visa options because Siobhan, I think we would be best to be getting the East Africa visa. Does that cover Uganda and Rwanda? I think that's what I've done previously.
Yes.
Oh, you're muted.
Yes. Yes. Yeah. Sorry. Yeah, it'll be interesting to see, as travel opens up, if there will be any differences in terms of, the ability. In some countries, you were able to get visas on arrival, which, may not be available when visas open up. We've seen now in some cases like India is starting to issue some business visas, but they're not allowing electronic visas at this point. So, there could be a period of time where it's much more strict.
Yes, and we will definitely be following that, and we will help you through the process, Rita, for sure. Michelle, can you tell me your thoughts on whether the trip to Croatia scheduled for August 28th will happen? Thank you, Michelle. So she's asking about the trip to Croatia we have scheduled for August 28th. At this point in time, we are all ready, set to go, but again, watching everything, and if at a point we feel that it's not going to be safe to go, probably sometime before final payment, then we will definitely reschedule that trip. But it's looking very positive for kind of getting into September at this point in time. And August 28th is pretty close to September. So we're very positive about it and definitely hoping that that trip will be a go. Oh, Jessica I'm asking if what is the requirement now? And she's the one looking to come into Canada. So as of right now, then yes, it's a negative COVID test. It's a 14-day quarantine, and it's a 3-day mandatory, very expensive quarantine at a government, not run, but government planned hotel at your first point of arrival. So right now, you don't want to be coming to Canada. It's like something like $2,000 for the 3 days at the hotel.
And to add to that, Marianne, it's Peta. Canada is only accepting essential travelers, so you have to prove that you travel to Canada is essential as well.
Yeah.
Thank you.
Yeah, so right now, they're you know, it's not really the time to travel to Canada. Oh, Lucy is on the August Rhine River cruise for 2021. Do you need any special shots for this trip? At this point, no, you don't. It will just be if at some point the COVID vaccine becomes a requirement, then we will definitely let you know, and we'll keep you up to date on that. And a visa, I don't know, Debbie might know. I don't think we require a visa for any of the countries visited, but again, that will be something that we will let you know for that. But I don't think you need a visa for the Rhine River cruise.
Can I bring that up, Marianne? So is it referred to as the Schengen visa for the EU? Are they not introducing that at the end of 2022?
She's on 2021 now.
Yeah,
Yeah, I don't know.
No, but I meant in 2022.
yes, they are. I mean, there's like the European Union, you know, for many years, people coming from Europe to the US needed to get an electronic travel authorization in order to do that. And the European Union is implementing that for US and Canadian citizens. It's scheduled to start in 2022. You know, with COVID-19, not sure if that will go off as planned, but it's been in the works for a while.
Great. Thank you.
And Erica is asking about her Portugal riding tour at the end of September. And so again, September, we're fully, you know, expecting and hoping that all those trips are a go. That is our kind of month that we see our light at the end of our tunnel. The final payment is in July, and for sure, if we know that it just can't be a go at that point for some reason, we will change it before then. But again, we're really seeing, you know, September as being a positive for us for travel. What if you cannot make the trip during their scheduled dates? Can you choose another trip? So we really work with, because we do such small groups, Jennifer, so she's asking about if you're booked on a trip and it gets rescheduled and you can't make those dates, can you choose another trip? So yes, so because we're a very small group, we really work with the people booked on the group to see, you know, can you do these dates? If you can't, we try and work with other options for you. We, you know, we'll work with you and sort something out if you can't do those rescheduled dates. I know that I saw something, I lost it. Carol?
Marianne, just a comment. Jennifer is on Uganda, so it's a little different in that permits have already been
So we do have Uganda also scheduled for 2022. And I think Carol asked a very similar question. She's also on the same trip, that if for some reason it doesn't go this September, will you automatically get put over? So you wouldn't automatically get put over to the next Uganda trip, but we would definitely save a space for you and give you first option to move to that trip. So, and the thing to know with the gorilla trekking, because that's the Uganda is a gorilla trekking trip, that we've already paid for your trekking permits. Those have to be paid very far ahead of time. They sell out. So that's kind of that first big deposit went to secure those trekking permits. Those trekking permits are non-transferable and non-refundable. Once they're bought, you own it, it's your day, that's all you get. That being said, when COVID hit the first time and they closed the trekking, they did, anybody that had trekking permits, because they canceled it, they then moved we're allowing people to move their trekking permits to a new day. So like canceling the Uganda trip this September would only happen if Uganda can't close down and shut off their trekking, which unless things drastically go terrible again in this world, they're not going to, because they've already opened up and they're already doing trekking right now. So it's highly unlikely that that trip, unless something really kind of unusual happens, is going to get canceled or rescheduled at this point.
Thank you. Marianne, there's a question from, I'm not sure if Susan can speak to Allianz in the US, because the question was raised about what Allianz offer in their that would be equal to Counsel for Any Reason in Canada.
So I can't really provide a lot of detail other than saying that we do have cancel for any time, so that there are some restrictions around that. But it's not as flexible as the cancel for any reason. And so, but I'm sorry, I really prefer not to give any information at this point, but I'm happy to reach out to my colleagues in the US if I can help in any way, Irene, to provide you with that information.
Thank you. Then if I will certainly let our client know, and I'll get back to you. Thank you.
If you want to send me an email, I'm happy to help in any way.
Great, thank you.
Thank you. Thanks, Irene. Okay, so now I'm going to go just to let people come on and kind of talk if they want. So if you have something that you want to say or something you want to ask, you can just raise your hand. So there's a little button to raise your hand. And then I'll go through the hands raised and open your microphone for you to talk. We're going to start with Lucy. Hi, Lucy. I think you're still muted, so you just have to press the button to unmute yourself, and then you can talk.
Did I unmute myself?
You did. Hi, Lucy. How are you?
I'm doing fine. Hey, my question is, okay, I'm scheduled for that this August on that River Rhine cruise.
Yes.
And I noticed that there's a River Rhine cruise in 2022. Now, my cruise is still going, correct, in 2021?
Yes, as of this
August?
time it is.
It is. Okay, and then our last payment is in June, I think, Mary, or I think I got a notice saying it's in June.
In June.
Okay. And you
Debbie
said
or
no-
Irene would maybe know.
Irene.
Yeah.
I think you sent me some. Now, my passport, okay, it's okay right now, but it's due in July, I think, of 2022.
Okay.
That'll be okay for this trip as long as it's not postponed any, correct?
Correct. It has to be
Okay.
6 months, so you're within the
Okay.
6 months. Yeah.
Okay, now the COVID test, I've had 3 of them. I
Oh,
just had one for my surgery. I had 2 for different surgeries and 1 because I wanted it. Now I've had both vaccines here.
Okay,
with
congratulations.
Pfizer. So do I still have to get another COVID test before I fly in August?
You know what? We don't know what the rules will be in August. So that is a case of we will just continue to monitor it.
Okay.
August is a long time away. So
Yeah.
if they do require you to have a negative test, they're going to give a time frame. So it could be, 96 hours or 72 hours. So you're going to, if they do require, you would need to get another test. But at this point, especially with the fact that you've had both vaccines, I would hold tight and not really worry about that.
Okay, because
Can I-
it takes like 5 days for them to get a result, or sometimes 10 days to get a result. That's what I'm concerned about.
Okay. I think Peta, did you have something? Was that Peta?
It was
Oh, it was
Susan.
Susan.
Yeah. So I'm sorry, it was that Lucy? I'm not sure if
Yeah.
you're
Yes,
from
Lucy.
the
Yeah.
US or from Canada.
US.
Oh, okay. Because I don't want to comment on US as I said, but the one thing that came to mind for me, so in Canada with the COVID-19 plan, so let's say that you are traveling in August and that it goes through with us in Canada, for example, if you buy the COVID-19 insurance and you travel, The only thing that we're going to do a medical review on is COVID-19. We're not going to look at anything else. But from what you've said, if we looked at your file, it would show that you had a positive test and still traveled. And the one thing that we require is if you did have COVID, if you did get COVID at destination, and when we do the medical review, if we see that you had COVID previously to traveling and did not get a negative test before you traveled, then you would not be covered.
Oh,
So
I
I
don't
would
think
just-
she had COVID.
Oh.
I think she had 3 COVID tests and she's had both COVID vaccines.
Oh, I'm sorry. I thought she said they were all positive.
No, 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 no.
Oh, thank
they've all
goodness. I was
been
thinking, oh
negative.
my goodness.
No, they're all negative, and 2
Okay.
was because I had to have surgery on 2
Okay,
different
thank
times.
you.
So
Okay,
they're
thank
all
you.
negative, and I have
was-
my vaccines.
Fantastic. I'm glad to hear that. And I hope the surgery went well. And I'm glad that we sorted that out. I hope I
Yeah.
didn't confuse
Yeah, don't give me-
anybody.
Don't give me positive.
Yeah, no positive.
No, I'm fine. Okay.
Yeah, I think just hold tight, Lucy. I think that you've had both vaccines is a very good positive in this.
Yes.
And just as we get closer, we'll see. Peta, did you have something to add on that or no?
No.
You just popped up on my screen.
Oh.
Okay. Did you have any other questions, Lucy?
I think that's it for now.
Okay, well, thank you. Have a great day and we will talk soon. I'm going to mute you. And anybody else? Last call, raise your hand if you have a question or type it in.
I have one comment while
Yes.
if anybody's thinking is, so you have so inspired me to travel. I've traveled a lot, of course, being in the travel industry all these years, and I've done lots and lots of solo travel on my own. But at this age and stage, and I'm healthy, but I'm still at that stage in my life, I'm sitting here thinking, oh my gosh, which trip am I going to go on? So thank you. That was
Well,
my
thank
only
you.
comment.
We would love to have you on a trip. I can tell you that. Oh, well, I want to really thank our guests for being here. I want to really thank all of our attendees for joining us. I hope everybody enjoyed it. I hope everybody learned something and feels a little bit more confident, because I can tell you, just watching things unfold even the last few days, I'm feeling much more confident about, travel towards the end of the year. And I am just so excited to get back out there and to be spending time with you instead of just on a Zoom. So I can't wait. And I hope everybody has a great day. Thank you. Thank you. And we will, I don't know, meet next week, I guess. So next week, I should tell you what is next week. Next week, we are heading off on our California wine tour. So this is San Francisco, Napa Valley, Sonoma Valley, the Napa Valley wine train. I'm very excited. This is like most tours are Debbie's baby. This tour was one of my babies. So I can't wait to present this tour and to walk you through it. I hope you join us next week and we will head to California. Thanks, everybody. Have a great day. Thank you, Debbie and Irene, for helping me and everything. And we will see you next week. Take care.
Thank you. Thank you for having us. Bye.
Bye.
Thank you. Take care.
Bye.